In this video we will tell you about the causes and identifying symptoms of Graves' disease. The National Institute of Diabetes and Digestive and Kidney Diseases (NID) evaluated that cause of Graves' disease is still not clear, may be initiated with gene factor or with external triggers such as viral infections. If the person have a previous history of Graves' disease, he/she is more liable to get this disease in its life. Some other autoimmune states increase the risk of Graves' disease. The presence of rheumatoid arthritis may increase the risk of Graves' disease by 39%. The association between pernicious anemia and autoimmune thyroiditis suggests that there should be a common pathogenic mechanism indicating an autoimmune phenomenon, including the thyroid and stomach, probably due to an altered immune response in genetically predisposed individuals. There is an increased frequency of pernicious anemia in patients with hyperthyroidism. Conversely, patients with pernicious anemia have a higher incidence of hyperthyroidism. The two glands work together to supply essential hormones and deliver them where they need to be throughout the body. When your adrenal glands aren't producing enough cortisol and you have a thyroid problem, it can make the situation much worse. Several studies suggested that Addison's disease is associated with the thyroid levels in the body. Graves' disease can mimic systemic lupus erythematosus. The differentiation requires careful laboratory evaluation. Moreover, both autoimmune diseases may occur in the same patient. Systemic lupus erythematosus can lead to thyroid problems in some patients, including autoimmune thyroid disease. Celiac disease is a digestive and autoimmune disorder that can damage your small intestine. People with celiac disease might experience symptoms like diarrhea, bloating, gas, anemia, and growth issues. Celiac disease can be triggered by a protein called gluten. Celiac disease is associated with hyperthyroidism and hypothyroidism. Symptoms of Graves' disease and thyroid function tests may improve with gluten-free diet. Increased intestinal permeability can increase immune activation involved in thyroid disease. Graves' disease is a risk factor for type 1 diabetes, as seen in the present study in which 2 out of 158 patients with Graves' disease developed type 1 diabetes during the course of 8 years. Vitiligo is a condition in which the skin loses its pigment cells melanocytes. This can result in discolored patches in different areas of the body, including the skin, hair, and mucous membranes. Several studies have suggested vitiligo is associated with a variety of other autoimmune diseases, including thyroid conditions, alopecia areata, type 1 diabetes mellitus, pernicious anemia, and rheumatoid arthritis. The eyes of people with Graves' disease may appear enlarged because their eyelids are retracted, seem pulled back into the eye sockets, and their eyes bulge out from the eye sockets. This condition is called Graves' Ophthalmopathy. The result is inflammation and a buildup of tissue and fat behind the eye socket, causing the eyeballs to bulge out. Rarely, inflammation is severe enough to compress the optic nerve that leads to the eye, causing vision loss. About 25 to 30% of people with Graves' disease develop mild GO, and 2 to 5% develop severe GO. This eye condition usually lasts 1 to 2 years and often improves on its own. GO can occur before, at the same time as, or after other symptoms of hyperthyroidism develop, and may even occur in people whose thyroid function is normal. The symptoms usually develop within 6 months of diagnosis of Graves' disease. Graves' ophthalmopathy symptoms can include inflammation of the whites of the eye, redness, swollen or retracted eyelids, sensitivity to light, an irritated or gritty feeling in the eye, dryness or watery eyes. Graves' ophthalmopathy symptoms can include exophthalmos, bulging eyes, which is considered to be one of the main symptoms in the case of Graves' disease, puffy eyelids, double vision, pressure or pain in the eyes, trouble moving the eyes. Eye drops can relieve dry, gritty, irritated eyes, the most common of the milder symptoms. If pain and swelling occur, healthcare providers may prescribe a steroid such as prednisone. Other medications that suppress the immune response may also provide relief. Special lenses for glasses can help with light sensitivity and double vision. People with eye symptoms may be advised to sleep with their head elevated to reduce eyelid swelling. If the eyelids do not fully close, taping them shut at night can help prevent dry eyes. In more severe cases, external radiation may be applied to the eyes to reduce inflammation. Like other types of radiation treatment, the benefits are not immediate. Most people feel relief from symptoms 1 to 2 months after treatment. Surgery may be used to improve bulging of the eyes and correct the vision changes caused by pressure on the optic nerve. A procedure called orbital decompression makes the eye socket bigger and gives the eye room to sink back to a more normal position. Eyelid surgery can return retracted eyelids to their normal position. It is a neuromuscular disorder associated with hyperthyroidism and Graves' disease. It occurs with the excessive production of thyroxine. Symptoms of myopathy includes muscle weakness, myalgias, muscle tenderness, wasting of the pelvic girdle and shoulder muscles, fatigue, and/or heat intolerance. Treatment involves restoring normal levels of thyroid hormone and may include thyroid drugs, radioactive iodine, and sometimes partial or complete surgical removal of the thyroid. With treatment, muscle weakness may improve or be reversed. Pertibial myxedema associated with Graves' disease. It is distinguishing characteristic, trait, or feature of Graves' disease. A small number of people with Graves' disease also experience thickening and reddening of the skin on their shins. This usually painless problem is called pertibial myxedema or Graves' dermopathy. Pertibial myxedema, also called localized myxedema, thyroid dermopathy, or infiltrative dermopathy, is an infrequent manifestation of Graves' disease. It is considered to be the third signs of Graves' trade symptoms of goiter, or PATHOPHYSIOLOGY, and pertibial myxedema. Generalized myxedema is associated with only the hypothyroid state, whereas pertibial myxedema is characteristically associated with Graves' disease. Patients with pertibial myxedema may be hypothyroid, hyperthyroid, or euthyroid when the skin disorder appears. Stay connected for more healthy updates. Do like and subscribe our YouTube channel.